Dr. John Davis.
Glaucoma surgeries, MIGS in 3D printed and mixed reality by Dr. John Davis AKKARA. The authors have no financial interest in this presentation. All the designs are open source and uploaded for free on thingiverse.com and 3d.nih.gov. We have designed 3D models of the iStent Inject and iStent W Inject using free software such as FreeCAD. These models can be 3D printed and also rotated in mixed reality. We also modeled the Kahoot Dual Blade Glide, KDB Glide. All these things can be printed easily in a resin 3D printer using the SLA LCD technology. We also designed some other models of glaucoma drainage devices, and these can also be 3D printed. We have also made 3D models of Seoni CTR, regular CTR, CTS, and VHEX-NIC. We have also uploaded these designs to the National Institute of Health NIH 3D website. After you download, what do? You can go to Google Maps and find a 3D printing shop near you. So thank you. I hope this will help you to 3D print your design.
So how much IOP control are you aiming to achieve with your stents?
These are not for human use. These are for wet lab practice and teaching purposes.
Right.
So that's just a model of what you can do with it. You can use 3D printing to design new things, to make prototypes, and for teaching and for wet lab practice. And you can use it in augmented reality also.
So I think this topic is needs a little more explanation, and this was not fit for this.
For this 1-minute class.
It needs a lot of discussion and to understand.
Okay.
Anyway,
The point is you can use 3D printing to make prototypes of innovations that you have.
yeah, I know that.
Basically, the whole technology, not the...
So many of them even won't know what 3D printing is, how much cost is involved, what all can be printed, and what all is required. So it's really, I have visited LV Prasad Institute to see their 3D printer when I was the president, and we had a tie-up with the LV Prasad Institute and All India Institute, All India Optometrical Society. To all those who want to have the innovation can get tied up with the LV Prasad Institute, and they can have a 3D printer. But it's a wonderful machine costing more than 10 CR. And you give any design, they will do the 3D printing, and whether it's a metal, plastic, they will manufacture for you.
I would like to add, so if you want to get started with 3D printing, you can buy one for 15,000 rupees. Amazon, Google 3D printer, you can get 15,000 rupees.
But will it be able to manufacture?
You can make prototypes. You cannot use it in the human eye, but you can use it in the wet lab. You can show it to patients. You can use it to teach your students. You can use it in classrooms. You can use it for
what all material it can handle? I mean, plastic
So
only?
the 15,000 rupees one can handle plastic, PLA, ABS, and those sort of plastic which are flexible also. There is another one for around 30,000 which can handle resin, which gives a high resolution resin, which you can make transparent, translucent materials. If you go for a metal 3D printer, it goes to 10 CR.
How much that?
Metal is 10 CR. You don't need metal.
So
you
they
just
provide
can use
the
this.
plastic along with that?
So I would go for the plastic one for our own purposes, and once you want a final prototype, then you go to the companies and outsource that part alone.
They give the material along with that 3D printer?
So the material for the plastic material is 800 rupees per kilogram, and you use few grams for every prototype.
Okay,
So
thank you for bringing out a wonderful point. So all those innovators who really want to do something, there's something is stuck in their mind. So the 15,000 is nothing you can buy and try at home.
Yeah.
Thank you very much. Excellent presentation.